Potassium chloride, KCl. Expanded lecture note. Today, we're going to explore the essential compound potassium chloride, KCl. Potassium chloride is a vital electrolyte that plays a crucial role in various bodily functions, including nerve function, muscle contractions, and heart health. It's also used in medicine to treat potassium deficiencies and in industry for various applications. In this video, we'll cover the uses, benefits, and potential risks associated with potassium chloride. Let's dive in and learn more about this important compound. Objectives. At the end of this lecture, students should be able to 1. Define and describe potassium chloride, KCl. 2. Understand its classification, chemistry, and properties. 3. Explain its pharmacokinetics and pharmacodynamics. 4. Identify its clinical uses in medicine and anesthesia. 5. Discuss side effects, contraindications, precautions, and drug interactions. 6. Explain proper administration, dosage forms, and nursing considerations. 7. Understand toxicity, overdose management, and storage. Names for potassium chloride, KCl. 1. Generic name. Potassium chloride, KCl, the chemical name for the medication. 2. Brand names. K-Dur, a sustained-release tablet or capsule form of potassium chloride. Slow-K, a slow-release tablet form of potassium chloride. Chlorcon, a tablet or capsule form of potassium chloride, often used to treat low potassium levels. Count-Cl, a potassium chloride supplement, often used to treat hypokalemia. Kalium chloride, the German name for potassium chloride, highlighting regional naming variations. These names represent different formulations and brands of potassium chloride used to treat potassium deficiencies and related conditions. Introduction to potassium chloride. 1. Potassium chloride is the most commonly used potassium salt for prevention and treatment of hypokalemia, a condition where potassium levels in the blood are too low. 2. It is essential for maintaining cellular membrane potential, which allows cells to function properly and communicate with each other. 3. Potassium chloride plays a crucial role in nerve impulse transmission, enabling nerves to send signals throughout the body. 4. It is also vital for muscle contraction, helping muscles to move and function normally. 5. Additionally, KCl helps maintain acid-base balance, which is necessary for proper bodily functions and overall health. 6. KCl is widely used in clinical medicine to correct potassium imbalances and treat related conditions. 7. It is also used in anesthesia and intensive care to manage potassium levels in patients undergoing surgery or critical care, ensuring their safety and well-being. Common myths about potassium chloride. 1. Myth. Potassium chloride can be given as a rapid IV bolus. Fact. IV bolus administration can cause fatal cardiac arrest due to the risk of hyperkalemia, emphasizing the need for careful administration. Potassium chloride must always be given diluted and slowly through an IV to prevent severe complications. 2. Myth. Oral potassium is always safe. Fact. Oral KCl can cause gastrointestinal irritation, ulceration, or perforation if not given with sufficient water or food, highlighting the importance of proper administration. Taking oral potassium chloride with plenty of water or food helps minimize the risk of gastrointestinal side effects and ensures safe treatment. Classical definition of potassium chloride. 1. Potassium chloride is an inorganic salt, meaning it is not derived from living organisms and is synthesized chemically. 2. It is composed of potassium and chloride ions, which are essential for various bodily functions, including nerve function and muscle contractions. 3. Potassium chloride is used to restore normal potassium levels in the body, treating conditions like hypokalemia, low potassium levels, and preventing related complications. 4. By replenishing potassium, KCLs maintain proper cellular function, nerve impulse transmission, and muscle contractions, ensuring overall health and well-being. History of potassium chloride. 1. Potassium chloride was first isolated in the 18th century as part of potash compounds, marking the beginning of its discovery and study. 2. The medical use of potassium salts began in the 19th century, as scientists and doctors recognized their importance in treating various health conditions. 3. Today, KCl is classified as a World Health Organization (WHO) essential medicine, highlighting its critical role in fluid and electrolyte management in medical settings. 4. Its inclusion in the WHO Essential Medicines list underscores the importance of potassium chloride in saving lives and improving health outcomes worldwide. Classification of potassium chloride. 1. Pharmacological class. Electrolyte supplement. Potassium chloride helps maintain or restore the balance of electrolytes in the body, which is crucial for various physiological functions. 2. Therapeutic class. Potassium replacement agent. KCl is specifically used to treat or prevent low potassium levels, hypokalemia, in the blood, helping to restore normal potassium levels and alleviate related symptoms. Chemical properties of potassium chloride. 1. Molecular formula. KCl. The chemical formula indicates that potassium chloride is composed of one potassium K atom and one chlorine Cl atom. 2. Molecular weight. 74.55 grams per mole. This is the total mass of a single molecule of potassium chloride, calculated by adding the atomic masses of potassium and chlorine. 3. IUPAC name. Potassium chloride. This is the standardized name for the compound, following the International Union of Pure Applied Chemistry (IUPAC) nomenclature rules. 4. Structure. Ionic bond between K and Cl. The potassium and chlorine atoms are held together by an ionic bond, where potassium loses an electron to become a positively charged ion K, and chlorine gains an electron to become a negatively charged ion Cl. 5. Appearance. White crystalline powder. Potassium chloride appears as a white solid with a crystalline structure. 6. Odorless. Potassium chloride does not have a distinct smell. 7. Salt taste. The compound has a characteristic salty taste, similar to table salt, sodium chloride. Physical properties of potassium chloride. 1. Soluble in water, highly soluble. Potassium chloride dissolves easily in water, making it suitable for various medical and industrial applications. 2. Slightly soluble in alcohol. While KCl is highly soluble in water, it has limited solubility in alcohol, which is an important consideration for certain formulations. 3. Stable at room temperature. Potassium chloride remains chemically stable when stored at typical room temperatures, ensuring its effectiveness and safety. 4. Melting point. 770 degrees Celsius. The high melting point of KCl indicates its strong ionic bonds, requiring significant heat to break. 5. Non-volatile solid. Potassium chloride does not evaporate or vaporize easily, making it a stable solid under standard conditions. Mechanism of action of potassium chloride. 1. Provides potassium ions K, which are essential for maintaining various bodily functions. 2. Resting membrane potential in excitable tissues, neurons, muscles, myocardium. Potassium ions help establish and maintain resting membrane potential, allowing cells to respond to stimuli and function properly. 3. Nerve conduction and muscle contraction. Potassium ions play a crucial role in transmitting nerve impulses and regulating muscle contractions, ensuring proper communication between nerves and muscles. 4. Enzyme activation in carbohydrate metabolism and protein synthesis. potassium ions are necessary for the proper functioning of certain enzymes involved in energy production and protein synthesis. 5. Acid-base regulation by exchange with hydrogen ions. Potassium ions help regulate acid-base balance in the body by exchanging with hydrogen ions, maintaining proper pH levels and overall homeostasis. Pharmacokinetics of potassium chloride. 1. Absorption. Rapidly absorbed from GI tract, oral route. When taken orally, potassium chloride is quickly absorbed into the bloodstream through the gastrointestinal tract. 2. Distribution. Widely distributed, mostly intracellular, 98% inside cells. Potassium ions are distributed throughout the body, with the majority found inside cells, where they play crucial roles in various cellular functions. 3. Metabolism. Not metabolized. Potassium chloride is not broken down or metabolized by the body. Instead, it is used in its ionic form to perform various physiological functions. 4. Excretion. Primarily renal, 90%, small amount via sweat and feces. The majority of potassium ions are excreted through the kidneys, in urine, with smaller amounts eliminated through sweat and feces. 5. Half-life. Depends on renal function and total body potassium balance. The duration that potassium ions remain in the body depends on how well the kidneys function and the overall balance of potassium in the body. Pharmacodynamics of potassium chloride. 1. Restores normal potassium levels, correcting hypokalemia. Potassium chloride helps increase low potassium levels in the blood, treating hypokalemia and related symptoms. 2. Stabilizes cardiac electrophysiology and prevents arrhythmias. By restoring normal potassium levels, KCl helps regulate heart rhythm and prevent potentially life-threatening arrhythmias. 3. Facilitates normal neuromuscular transmission. Potassium ions play a crucial role in transmitting nerve impulses to muscle, ensuring proper muscle function and movement. 4. Maintains cellular homeostasis and osmotic balance. Potassium helps regulate the balance of fluids and electrolytes within cells, maintaining proper cellular function and overall health. Clinical uses of potassium chloride. 1. Treatment of hypokalemia. Most common, potassium chloride is primarily used to treat low potassium levels in the blood, which can be caused by various factors. 2. Due to diuretics, diarrhea, vomiting, corticosteroid therapy, or DKA, hypokalemia can result from certain medications, illnesses, or conditions that lead to excessive potassium loss. 3. Prevention of hypokalemia. KCl is also used to prevent low potassium levels in patients who are at risk. 4. In patients on long-term diuretic therapy or digitalis, patients taking certain medications, such as diuretics or digitalis, may require potassium supplements to prevent hypokalemia. 5. Cardiac conditions. Potassium chloride is used with caution in cardiac patients to prevent digitalis toxicity, which can occur when digitalis levels become too high. 6. Anesthesia ICU. KCl is used to correct electrolyte imbalances during the perioperative period and in critical care settings, ensuring patients' safety and stability. 7. Other, component of parenteral nutrition. Potassium chloride is also included in parenteral nutrition formulations to provide essential potassium ions to patients who require intravenous nutrition. Dosage and administration of potassium chloride. 1. Oral. Adults, 20 to 100 mEq per day in divided doses. With meals, the typical oral dose for adults is 20 to 100 milliequivalents per day, taken in divided doses with meals to minimize gastrointestinal side effects. 2. Children, 1 to 2 mEq per kilogram per day. The oral dose for children is calculated based on their weight, typically 1 to 2 milliequivalents per kilogram per day. 3. IV. Severe hypokalemia must be diluted and given slowly. For severe cases of low potassium, Potassium chloride is administered intravenously, but it must be diluted and given slowly to avoid complications. 4. Typical rate: 10 to 20 mEq per hour via central line. The typical rate of IV administration is 10 to 20 milliequivalents per hour, often given through a central line for safe delivery. 5. Maximum: 40 mEq per hour in ICU with cardiac monitoring. In intensive care settings with cardiac monitoring, the maximum rate can be increased to 40 milliequivalents per hour. 6. Never give IV bolus leading to risk of cardiac arrest. Potassium chloride should never be given as an IV bolus, as this can cause a rapid increase in potassium levels, leading to cardiac arrest. Side effects of potassium chloride: 1. Gastrointestinal: nausea, vomiting, abdominal pain, diarrhea. Oral potassium chloride can cause stomach upset, nausea, vomiting, abdominal pain, and diarrhea in some individuals. 2. GI ulceration: potassium chloride can also cause ulcers in the gastrointestinal tract, especially if not taken with sufficient water or food. 3. Cardiac arrhythmias: cardiac arrest, if given rapidly. Rapid administration of potassium chloride can lead to life-threatening arrhythmias or cardiac arrest. 4. Local phlebitis: pain at injection site. Intravenous administration of potassium chloride can cause inflammation of the veins, phlebitis, or pain at the injection site. 5. Others: hyperkalemia, muscle weakness, paresthesia, ECG changes. Elevated potassium levels can cause muscle weakness, abnormal sensations, paresthesia, and changes in electrocardiogram (ECG) readings, highlighting the importance of monitoring potassium levels. Contraindications for potassium chloride: 1. Hyperkalemia. Potassium chloride is contraindicated in patients with already elevated potassium levels, as it can worsen hyperkalemia and lead to serious complications. 2. Severe renal impairment, oliguria, nuria. Patients with severe kidney dysfunction may be unable to effectively eliminate excess potassium, increasing the risk of hyperkalemia. 3. Untreated Addison's disease. Patients with untreated adrenal insufficiency, Addison's disease, may have impaired potassium regulation, making them susceptible to hyperkalemia. 4. Severe tissue trauma, burns. Risk of hyperkalemia. Severe injury or burns can lead to the release of potassium from damaged cells, increasing the risk of hyperkalemia. 5. Concurrent potassium-sparing diuretics, spironolactone, amiloride, triamterene. Using potassium chloride with potassium-sparing diuretics can increase the risk of hyperkalemia, as these medications reduce potassium excretion in the urine. Precautions for potassium chloride: 1. Use cautiously in renal impairment. Patients with kidney dysfunction require careful monitoring, as their kidneys may not be able to effectively eliminate excess potassium. 2. Heart failure. Potassium chloride should be used with caution in patients with heart failure, as they may be more susceptible to electrolyte imbalances and cardiac complications. 3. Dehydration. Dehydrated patients may have altered potassium levels, and potassium chloride should be used cautiously to avoid exacerbating electrolyte imbalances. 4. Patients on ACE inhibitors, ARBs, or NSAIDs. These medications can increase potassium levels, and concurrent use with potassium chloride requires careful monitoring to avoid hyperkalemia. 5. Always monitor serum potassium (ECG). Regular monitoring of potassium levels and electrocardiogram (ECG) readings is essential to ensure safe treatment and prevent potential complications. Drug interactions with potassium chloride: 1. Potassium-sparing diuretics. Risk of hyperkalemia. Medications like spironolactone, amiloride, and triamterene can increase potassium levels, and concurrent use with potassium chloride may lead to severe hyperkalemia. 2. ACE inhibitors, ARBs. Additive hyperkalemia. angiotensin-converting enzyme (ACE) inhibitors and angiotensin receptor blockers (ARBs) can increase potassium levels, and combining them with potassium chloride may further elevate potassium levels. 3. NSAIDs. Reduce renal excretion of nonsteroidal anti-inflammatory drugs (NSAIDs) can decrease the kidney's ability to eliminate potassium, potentially leading to hyperkalemia when used with potassium chloride. 4. Digoxin. Low K increases toxicity risk. High K decreases digoxin efficacy. Potassium levels can impact the effectiveness and toxicity of digoxin. Low potassium levels increase the risk of digoxin toxicity, while high potassium levels may reduce digoxin's effectiveness. Toxicity and overdose management of potassium chloride. 1. Signs: muscle weakness, paresthesia, paralysis, bradycardia, arrhythmias, cardiac arrest. Potassium chloride overdose can cause a range of symptoms, from muscle weakness and abnormal sensations to threatening cardiac complications. 2. ECG changes: peaked T waves, widened QRS, sine wave pattern. Elevated potassium levels can lead to characteristic changes in electrocardiogram (ECG) readings, indicating potential cardiac risk. 3. Management. Stop KCl immediately. If potassium chloride toxicity is suspected, administration should be stopped immediately to prevent further potassium elevation. 4. IV calcium gluconate stabilizes myocardium. Calcium gluconate stabilize cardiac membranes and reduce the risk of arrhythmias. 5. IV insulin plus glucose drives K into cells. Insulin and glucose can help drive potassium ions into cells, temporarily reducing serum potassium levels. 6. Beta-2 agonist salbutamol. Salbutamol can also help lower potassium levels by promoting cellular uptake of potassium ions. 7. Sodium bicarbonate. In acidosis, if acidosis is present, sodium bicarbonate may be used to help manage potassium levels and acid-base balance. 8. Hemodialysis if refractory. In severe cases of potassium chloride overdose that do not respond to medical management, hemodialysis may be necessary to rapidly reduce potassium levels. Storage and disposal of potassium chloride. 1. Store at room temperature 20 to 25 degrees Celsius. Potassium chloride should be stored in a cool, dry place with a consistent temperature between 20 to 25 degrees Celsius. 2. Keep away from moisture and light. Moisture and light can affect the stability and potency of potassium chloride, so it should be stored in a way that minimizes exposure to these factors. 3. IV solutions must be diluted before administration. Intravenous solutions of potassium chloride must be diluted according to established protocols to ensure safe administration. 4. Dispose as per hospital biomedical waste protocols. Potassium chloride waste should be disposed of according to hospital protocols for biomedical waste, ensuring safe and environmentally responsible disposal practices. Nursing and clinical management of potassium chloride. 1. Monitor serum potassium frequently. Regular monitoring of potassium levels is crucial to ensure safe treatment and prevent potential complications. 2. Monitor ECG during IV infusion. Continue electrocardiogram, ECG, monitoring during intravenous infusion helps identify potential cardiac complications early. 3. Educate patients to take oral KCl with food, water to reduce GI upset. Patients should be advised to take oral potassium chloride with food and plenty of water to minimize gastrointestinal side effects. 4. Avoid salt substitutes containing potassium. Patients on potassium chloride should avoid using salt substitutes that contain potassium to reduce the risk of hyperkalemia. 5. Ensure infusion is via central line for high concentrations. High concentrations of potassium chloride should be administered through a central line to reduce the risk of vein irritation and other complications. Use of potassium chloride in ICU. 1. Correction of hypokalemia in critically ill patients. Potassium chloride is used in the ICU to treat low potassium levels in critically ill patients, helping to restore normal cardiac and muscular function. 2. Use in total parenteral nutrition (TPN). Potassium chloride is an essential component of total parenteral nutrition, providing necessary potassium ions to patients who require intravenous nutrition. 3. Must be given under continuous cardiac monitoring. Due to the risk of cardiac complications, potassium chloride should be administered in the ICU under continuous cardiac monitoring to ensure patient safety. Use of potassium chloride in anesthesia. 1. Correction of perioperative hypokalemia. Potassium chloride is used to treat low potassium levels in patients undergoing surgery, helping to maintain normal cardiac function. 2. Prevents arrhythmias during anesthesia. By correcting potassium levels, potassium chloride helps reduce the risk of arrhythmias during anesthesia, ensuring a safer surgical experience. 3. Must be checked before muscle relaxants are given, especially non-depolarizing. Potassium levels should be checked before administering muscle relaxants, particularly non-depolarizing agents, as abnormal potassium levels can affect their efficacy and safety. Use of potassium chloride in emergencies. 1. Severe hypokalemia causing life-threatening arrhythmias. Potassium chloride is used in emergency situations to rapidly correct severely low potassium levels that can lead to life-threatening heart rhythm disturbances. 2. Part of CU electrolyte management protocols. In intensive care units, potassium chloride is an essential component of electrolyte management protocols, helping to maintain stable potassium levels and support critical care. Comparison of potassium salts. 1. Potassium chloride (KCl). This is the most commonly used potassium salt for treating hypokalemia due to any cause, particularly in cases caused by diuretics. 2. Potassium bicarbonate (KHCO). This salt is especially useful in cases of hypokalemia accompanied by metabolic acidosis, as it helps replenish both potassium and bicarbonate levels. 3. Potassium citrate (KCHO). Potassium citrate is often used to treat conditions like kidney stones and renal tubular acidosis, and it has the added benefit of alkalinizing the urine. 4. Potassium phosphate (KPO). This salt is used in cases where patients have both hypokalemia and hypophosphatemia, making it particularly useful in ICU settings and nutrition therapy. 5. Potassium gluconate. This form of potassium is typically used as a dietary supplement and is suitable for mild cases of hypokalemia, but it is only for oral use. ECG changes in hypokalemia versus hyperkalemia. Hypokalemia. 1. Flattened T waves. Low potassium levels can cause T waves to become flattened or inverted. 2. U waves. U waves may appear, which can be a sign of hypokalemia. 3. ST depression. The ST segment may become depressed, indicating potential cardiac issues. 4. Prolonged QT. The QT interval can become prolonged, increasing the risk of arrhythmias. 5. Ventricular arrhythmias. Hypokalemia can lead to potentially life-threatening ventricular arrhythmias. Hyperkalemia. 1. Peaked T waves. Elevated potassium levels can cause T waves to become peaked and narrow. 2. Widened QRS. The QRS complex can become widened, indicating slowed ventricular conduction. 3. Sine wave. In severe cases, the ECG can take on a sine wave pattern, which is a pre-terminal rhythm. 4. Ventricular fibrillation. Hyperkalemia can lead to ventricular fibrillation, a life-threatening arrhythmia. 5. Asystole. In extreme cases, hyperkalemia can cause asystole, or cardiac arrest. Summary of potassium chloride (KCl). Drug details. Drug. Potassium chloride KCl. Class: electrolyte supplement. Mechanism of action: restores potassium levels in the body, maintaining normal membrane potential, neuromuscular function, and cardiac rhythm. Pharmacokinetics: absorption: rapidly absorbed orally. Distribution: mostly intracellular. 98% of potassium is found inside cells. Excretion: primarily renal, excreted through the kidneys. Clinical uses: treatment and prevention of hypokalemia. Used in digitalis therapy to prevent toxicity. ICU applications: total parenteral nutrition (TPN) and electrolyte correction during anesthesia. Dosage: oral 20 to 100 mEq per day. IV 10 to 20 mEq per hour, maximum 40 mEq per hour with ECG monitoring. Side effects: gastrointestinal irritation, nausea, vomiting, diarrhea. Arrhythmias, abnormal heart rhythm. Hyperkalemia, elevated potassium levels. Contraindications: hyperkalemia, high potassium levels. Renal failure, kidney dysfunction. Potassium-sparing diuretics, medications that reduce potassium excretion. Addison's disease, adrenal insufficiency. Drug interactions: ACE inhibitors and ARBs, medications for high blood pressure and heart failure. NSAIDs, nonsteroidal anti-inflammatory drugs. Potassium-sparing diuretics. Digoxin, medication for heart failure and arrhythmias. Toxicity. Signs: muscle weakness, paralysis, peaked T waves on ECG, arrhythmias, cardiac arrest. Management: stop potassium chloride administration, administer IV calcium, insulin and glucose, beta-agonist bicarbonate, and consider dialysis. Special uses: anesthesia: prevents arrhythmias during surgery and requires checking potassium levels before administering muscle relaxants. ICU: used for electrolyte replacement in TPN and correction of severe hypokalemia. Emergency: used to treat life-threatening hypokalemia with arrhythmias. Precautions: never administer as an IV bolus, always dilute before IV administration. Cardiac monitoring is required during IV administration to prevent complications. Key clinical pearls for potassium chloride. 1. Never give KCl IV undiluted. Right pointing arrow. Cardiac arrest risk: administering undiluted potassium chloride intravenously can cause a rapid increase in potassium levels, leading to cardiac arrest. 2. Hypokalemia worsens digoxin toxicity, leading to always correct before giving digoxin. Low potassium levels can increase the risk of digoxin toxicity, so it's essential to correct hypokalemia before administering digoxin. 3. Always monitor ECG plus serum K during placement. Continuous monitoring of electrocardiogram, ECG, readings and serum potassium levels is crucial during potassium replacement to prevent potential complications. 4. Oral KCl leading to always give with food, water to prevent GI injury. Oral potassium chloride should be taken with food and plenty of water to minimize gastrointestinal side effects and prevent injury to the GI tract. 5. In DKA treatment, insulin therapy lowers K, leading to replace K before giving insulin if low. During treatment of diabetic ketoacidosis, DKA, insulin can lower potassium levels further. If potassium is low, it should be replaced before administering insulin to avoid complications. OSCE exam tip questions for potassium chloride. 1. Why is KCl never given IV bolus? Administering potassium chloride as an IV bolus is contraindicated due to the risk of fatal cardiac arrest caused by sudden and severe hyperkalemia. 2. What ECG change is first seen in hyperkalemia? The first ECG change typically seen in hyperkalemia is peaked T waves, which can indicate elevated potassium levels. 3. What is the maximum rate of IV KCl infusion? The maximum rate of IV potassium chloride infusion is 40 mEq per hour, and this should be done with cardiac monitoring, preferably through a central line. 4. Name 2 drugs that increase risk of hyperkalemia with KCl. Several medications can increase the risk of hyperkalemia when used with potassium chloride, including ACE inhibitors, potassium-sparing diuretics, ARBs, angiotensin receptor blockers, NSAIDs, nonsteroidal anti-inflammatory drugs. Thank you for watching. If you liked this content, don't forget to like to show your support, comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.